Hey everybody, I am back and I have decided to make a video for my nursing playlist. I am trying to basically go back to school. I've decided to go back to school and I decided what better way to start studying than to maybe make videos. So this is basically about me studying drug classes, and today the first drug class I'm going to start out with is the beta blockers. Beta blockers, for some reason, I retain it. I feel like it's my favorite class of drug. I don't know why. I guess because the LOL, the law at the end, most beta blockers end in LOL. You know, we associate that with laugh out loud. So, lol, LOL. If you see that at the end of a drug, more than likely it's a beta blocker. And association with something positive, it makes it more fun. If you're in groups, or you know, I don't know, if you have an imagination, you can make it I don't know, you can just make it fun. So most beta blockers end in lol, like metoprolol, and I'll definitely get you guys some more examples. I have taken notes, so if you see me glancing over to the side, more than likely I'm reading my notes to you guys, because I don't know everything's not memorized, but I do know the basics, and I plan to, share with you guys and learn as I go. So most classes of drugs, you have the action, the side effects, the precautions, contraindications and teaching, and, more things than that. But those are like the main things when you have classes of drugs, or drugs in particular, to look out for. Now, the action of beta blockers consists of beta 1 and beta 2. Beta 1 action is primarily on the heart, and beta 2 action is actually primarily on the heart as well, but there's a difference. Beta 1 decreases your heart rate. It also decreases force of contraction, and it also delays impulse conduction. You see, I had to look over for a second, but yeah, beta 2, like I said earlier, it also primarily works on the heart, but it also blocks receptors in the lungs. It can cause bronchoconstriction. Now, if you don't know what some of these mean, my advice is, as you go along when you're studying, just to Google or Bing or whatever you use, look it up, because it's very helpful if you know the meaning of some of these words. It'll help you better understand the biology, pathophysiology, things like that. It'll help you to grasp the concept of what's going on in the body and maybe what you need to do, or it'll just better help you understand and figure out how to deal with the issue, or what the drug is doing, things of that nature. So beta blockers are used for angina, uncomplicated hypertension, and let's see here, dysrhythmias. So those are some of the main uses of beta blockers. I believe there is another, but those are the main 3 that I know of and that I've made notes on. As well as any contraindication. There may be with bradydysrhythmias, AV block. You'll have contraindications dealing with the beta 2 in chronic respiratory problems. So, as far as precautions with the beta blockers, take precaution with people who have hepatic and renal dysfunctions, as well as individuals with diabetes. You'll also want to be careful and take precautions with people with a history of depression and also heart failure. Now, how to help you realize or just know the side effects of the beta blockers. One of the main things is headache and flushing, dizziness, bradycardia, postural hypotension, there is a difference, and decreased cardiac output. The most frequent side effects are more than likely fatigue and weaknesses. But the most serious side effects are bronchospasm, bronchoconstriction, and congestive heart failure. So these are the signs and symptoms that you need to, know about, and it's very important to know, pay attention to certain signs that are serious. Like I said, the weakness and fatigue, those are the most frequent, but things that are like more serious and life-threatening, the congestive heart failure, the bronchoconstriction, the bronchospasm, basically we need to keep an eye on that because, like I said, it's serious and life-threatening, so that can really take a turn when taking beta blockers. Now, when taking beta blockers, as a nurse, we have to assess for symptoms of heart failure. And, that is, I would say that's a huge thing because, the beta blockers are basically working on the heart. So we have to look for signs and symptoms of heart failure. And we also have to, instruct the patient or the, the client, whichever word you want to use, to let us know if they have any weakness, fatigue, feelings of faint, like they're going to faint, any dizziness or lightheadedness, something like that. Just to let them know to report that to us so we can go ahead and look at them because that could be signs of something, serious. So before giving the patient beta blockers, we need to assess their blood pressure and their pulse for any significant changes that can play a major role as far as taking this medication. If the systolic blood pressure is below 90, you'll need to hold that medication. Do not give the medication if it's below 90. If that patient has diabetes, please monitor them because basically tachycardia can be masked as a beta-1 blockade, and normally tachycardia can be a symptom of hypoglycemia. So you want to monitor them, if they're diabetic due to that factor. Propranolol basically consists of beta-1 and beta-2 factors and is considered non-selective. Metoprolol is cardioselective, the heart. And I know you couldn't see me draw my heart, but I tried. And what that means is that it mainly blocks only beta-1. If you remember earlier what I said about the difference between beta-1 and beta-2, you know that beta-1 deals with the heart, and they both deal with the heart, but beta-1 is specifically specific to the heart, and with the beta-1 it decreases the heart rate, decreases force of contraction, and delays impulse conduction. With the beta-2, you're involved in the lungs, and that can cause bronchoconstriction. So with the cardioselective drug, metoprolol, it's cardioselective. So it's mainly dealing with the beta-1 portion of the beta blockers. Now, atenolol mainly, I believe it blocks beta-1. Let me look at my notes. Yeah, it's considered cardioselective to the beta-1 blocker, but with atenolol, it also can block the beta-2 blockers at high doses. And let's see, yeah, beta-2 at high doses. And I'm sorry if I messed this name up, but hold on. Nebivolol, it vasodilates, and and their third generation drugs block the beta-1 and 2 and alpha-1. Hold on. Carvedilol, Coreg. Y'all gotta work with me. But no, those are examples of the beta blockers. If you didn't notice, they all end in a wall, atenolol, carvedilol. Some of the ones I messed up, the vibilol, and propranolol. Let me go back. I think that can be pronounced in 2 different ways. It's kind of like one of those tomatoes, but I'm sure it's a correct way in the medical field. And it depends on where you're from. Some people from up north say things differently than how we say, you know, how people say in the south. So my whole point is they end in L-O-L. Most likely the beta blockers. I believe there are some that do not, but most of them end in L-O-L, and that's how you know they're a beta blocker. And let me think, is there anything else about beta blockers that I did not mention? Those are the main things about beta blockers that you more than likely need to know. So I will go ahead and stop at this point. But I do want you guys to know that I plan to make more medication, drug classes videos because, like I said, I am studying as I do this with you and, you know, refreshing myself on the drugs and hopefully teaching you guys as well at the same time. But I do thank you guys for watching, and I hope you guys have a wonderful day. Bye.